Restless Leg Syndrome, or Willis-Ekbom syndrome.
So you had restless legs. You said you had it, so you don't have it anymore?
I would say that I had it. I still have like periodic limb movements, but definitely the debilitating part is definitely gone.
Okay, let's tell people at the end of this video how you got rid of it.
Welcome to Talking with Docs. I'm Dr. Brad Weening.
I'm Dr. Paul Zalzal.
And today we're going to be talking about something that's very personal to me, or used to be more personal, because I had it.
You had restless leg syndrome?
I definitely 100% had restless leg syndrome. Ask my wife.
You look like you have restless teeth syndrome.
I don't know what that means. So we're going to talk all about it. We're going to talk about some of the symptoms, how you diagnose it, and potentially what to do for it. It's a tricky thing, and it affects a lot of people. So stick around and leave a comment. If you have restless leg syndrome, there's a lot of you out there, so leave a comment. Say how much it bugs you, and say what you've done that's had some success to help the other people.
So you're like not only a physician talking about it, you're also a patient who has
Also, definitely a patient. We've had this before with other things, right?
Yeah. You liked it so much, you bought the company.
Yes. Thankfully, I'm recovered mostly. So
right.
we'll share the story of kind of how that happened.
Are you though?
Yeah.
Still.
I'm fidgety by nature.
Okay.
Right?
Okay.
It's like that song, Naughty by Nature, except I'm fidgety by nature.
All right.
That's just my character, like
Let's
my personality. I'm a little bit high.
You got restless syndrome.
I got restless, yeah, for sure.
I think I have apathetic leg syndrome.
You do?
Yeah. I just don't feel like moving sometimes.
I know. I have been accused of being, well, we'll talk about it.
Okay.
Okay, so restless leg syndrome, what is it? So it's exactly like it sounds. So people that have restless legs. And when you ask someone to describe it, there's a wide variety of descriptions, and it's an overwhelming urge to move your legs, and that feels like your skin's crawling, or you can't really describe it. And the reason that this is because actually it's a neurological disorder where your brain is telling your legs to move. And some people say maybe this relates to anxiety from old like fight or flight kind of stuff. We don't totally understand it, and even the people that are dealing with it don't totally understand it.
Yeah, we've been looking at it for many, many years, hundreds of years. It's been recognized. I mean, you may not have heard about it. It's not one of the more common things that we discuss in medicine. However, it is a very common thing. Up to 5 to 10% of the population has this.
Up to 20% of pregnant women, they think maybe because the iron that's going to the baby. But yeah, first described in 1672 by Sir Thomas Willis of the Willis-Ekbom. And he's
not different strokes, Willis?
No, and not Bruce Willis.
Okay.
So Sir Thomas Willis was a very interesting guy. And at the beginning of medicine, I think it would have been a neat time because a lot of stuff wasn't discovered. So you could kind of get credit for a lot of stuff if you're at the front.
You know what? I would have loved it. I would take anything.
They'd be like Zalzal syndrome.
I'll take like a pimple on the end of the nose. If you get a pimple on the end of the nose, that's Paul's pimple.
It's Paul's pimple.
Right? If you have a pathologic intolerance for incompetence, it's Dr. Weening syndrome.
Whoa,
Weening syndrome.
I feel like that could be Zalzal syndrome as well. Okay, so what happened? So this guy, very interesting guy in the early ages of medicine. And actually, he was responsible for a bunch of different stuff. He was one of the first people to talk about type 2 diabetes and the sweet urine.
Diabetes was actually called Willis disease back in the day.
Yeah, so
I think the sweet urine came from China and possibly India. They picked up on it pretty late. He's a British guy, English dude.
But he was one of the first guys that I guess to write about it formally. He was a guy who identified the arterial structure at the base of our brain, something called the circle of Willis. So people in medicine or medical students would know about this.
An anatomic structure named that.
I know. So and cool. He was also one of the first guys to number the cranial nerves.
That's right. I read that.
Yeah.
Too, which we still use today. 12 pairs of cranial nerves in your head and face. And 12 of them, and he was the first one to name it back in like the 1600s. And we still use that same numerical system that he came up with.
And he was friends with people like Einstein and John Locke, like sociologists.
Wait a minute. He couldn't have been friends with Einstein.
Yeah. No, not Einstein. Sorry. Newton. Newton. Yes. Sure. Like really prominent features of the time. Yeah. Another interesting thing is actually he revived a woman back from death. Him and his friend. A woman was charged with a crime, and she was actually hung, and put in a coffin. They donated her body. She was hanged. Yeah, so that's not something I use very often.
No.
Yeah.
Well, these days.
Yeah, thankfully. And her body was donated to science, and they opened up the coffin, and she was coughing.
And that's where the name coffin came from.
I don't think so, but maybe. Is it?
I just made that part.
But
it would be cool.
Anyway,
it would be cool.
So she was coughing. So him and his friend who were going to dissect her instead revived her, and she survived. Anne Green was her name.
Anne Green.
Yeah.
Lives to tell the story another day.
So that's the Willis. And then the Ekbom Carl Axel Ekbom was a
Irish guy.
Swedish neurologist who went on to further describe the symptoms and the treatment and stuff like that. So he got put on.
He's way later.
Way later, 1995, like
right?
just recent.
I mean, this disorder is, I think it's underdiagnosed.
I would agree.
Not talked about enough.
Right.
And so here it is.
Okay, so diagnostic criteria. So there are 5 of them. This has been formalized by a group that deals with restless leg syndrome. So the first one is that you have this irreversible urge to move your legs. So you actually have restless legs. That's number 1.
The symptoms come on when you're resting. Is that the other?
Right. So when you're kind of getting ready to go to bed, typically, or you're in a resting phase. Number 3 is that it's usually at night. Very rarely do people have restless legs in the morning or during the day. The 4th criteria is that they get better with movement.
Right.
And then the last one, like a lot of medical diagnostic criteria, is that it can't be readily identified as a cause or a result of something else, like a formal medical condition or behavioral condition. So if you had like bad veins, or if you had neurological disorder in your lower legs, and that caused restless
like
legs,
a Parkinson's disease
right,
or something like
then
that.
that's not restless legs.
And so this is a syndrome, so there's no diagnostic test for it. A syndrome is a collection of symptoms that we clump together and call it a syndrome because we don't have like a diagnostic test. There's nothing you can look at under the microscope that says, yeah, this is what it is.
Right. So who ends up going to their doctor? You get to decide kind of a little bit for yourself. A lot of people have it and just kind of manage it. But if your symptoms become so severe that they've become disruptive to your life, preventing you from able to sleep or have a normal relationship or do your job or whatever, then that's when people would go see typically their primary care doctor. But often a lot of primary care doctors don't know a lot about this and don't do a lot with restless leg syndrome.
No, it's not a well described or that well known or that well taught in medical school, to be honest.
Right. So if you see your family doctor and they don't know about it, they may send you on to a sleep specialist. So sometimes that could be a subspecialty within internal medicine, or often a neurologist, because it's seen actually as a neurological disorder, really.
And now, what's the neurologist going to do? We've talked about the symptoms. We're going to go see your doctor. There are, although there's no diagnostic test for it, there are some tests that you might have done that might indicate that you have it. Although they're not diagnostic, they're associated with restless leg syndrome.
Right. So the one thing that they've found that is more common than not in people that have restless leg syndrome is actually a low iron level. So we don't know exactly why, but this is common, and this is also why they think 20% of pregnant women have it, that maybe the iron is being shunted to grow a human being inside of you, and then that's resulting in a low iron level. So a lot of doctors would start with an iron test to start.
It is a little bit more common in pregnant women than the average population, up to 20%, whereas 5 to 10 in the regular population.
Yeah.
Low magnesium, that's also been associated with it.
And low iron is actually a little tricky to test. You mean you could have a low hemoglobin, but sometimes you can still have low blood iron, but they've shown you could actually have lower brain iron the way that it is tested or the way it's actually isolated. So that's not necessarily a guaranteed way, but I think these 2 things are important, magnesium and iron. And then the other one is a sleep study.
Yeah.
So usually you would not order specifically a sleep study to diagnose restless leg syndromes, but often if you have insomnia or if you have thought of sleep apnea, then you go for this test and they say, okay, well, now you got restless legs, or you talk about it and they realize maybe you got restless legs. The other thing that you often will find on the sleep study is that you have what are called increased periodic limb movements.
Right, so you went for the sleep study and then they say, your breathing's fine, but you have restless legs. And you're like, how'd you know? Well, Jim, you got up and tried to walk out the door 3 times in the middle of the night.
Right, so personally speaking, I have had a sleep study.
Okay.
So because I did, so when I first got married, my wife was like, are you on something? Because I often would get up in the middle of the night because my legs would be so restless, and it'd be like 12 or 1 in the morning, and I'd walk around, and I got this habit of going to drink chocolate milk in the middle of the night because I was convinced that was going to allow me to go to sleep. Because it got to the point where I'd just be lying there, and then I'd be getting anxious about not getting sleep because I had a busy day the next day. It was like a vicious cycle, like a lot of people that can't sleep properly do. So I went for the sleep study, and what did they say? They say, well, you don't have sleep apnea, so that's good, and that's an important one. We've talked about this in other videos that can have a lot of significant implications for your general health, particularly your heart. But I had a lot of what are called periodic limb movements, so my legs would kind of be moving around. I have the Jimmy legs.
Yeah, because she's throwing off my whole sleep. She's got the Jimmy legs.
Jimmy legs?
Jimmy leg.
Yeah,
the
like
sheets are on the floor by the end of the night.
Out, or I'd be kicking my wife and she's at lights.
She's on the floor by the end of the night.
What the heck? You're preventing me from getting sleep. But then they take the history and they're like, oh, well, it sounds like you have restless legs and periodic limb movements. So they kind of go together, but they are definitely not the same thing.
So she went for a sleep study to see what was wrong with her, and they said,
It was
you
me.
slept perfectly.
That's right.
It was amazing.
And the
Model.
studies themselves, you would think you're not going to get a good sleep because you have like probes on your head and on your chest, and it's a weird room and stuff like that, and people are watching you. But I actually had a pretty good sleep, which is interesting.
Except for the legs.
Except for the legs.
Okay, Willis.
Yeah.
Before we give away how you got rid of it.
Yes.
Okay, stick around till the end to find out how you got rid of it.
Yes.
Let's talk about some of the common treatments that are available. For
Okay.
this. And now, like with anything, no treatment is 100%. No treatment is perfect, and no individual might not benefit from the same treatment as someone else. You may have different response to treatment, but some of the common things that we talk about to treat certain medications.
Yeah, and I'd say or supplements. I'd say the first one is obvious. If you have low iron, you probably should treat your iron. Yeah. And this is going to be guided by a physician. It would start typically with oral supplements, but iron you can't just take willy-nilly. There are consequences to it, so it should be done supervised. Willy-nilly. If you do have really low iron and it's refractory to oral supplementation, then you may require intravenous iron. This is a common treatment for people that have low iron, so discuss that with your family doctor if that's one of your things. So let's correct the iron.
It's a fun thing to do. Some complications with getting intravenous iron.
No, and the other reason that they think iron's important is because of its effect on dopamine in your brain, because a lot of the restless legs kind of comes back to dopamine, and iron often is transported with dopamine, and it has a dependency with the receptors, so they're very intimately related. So the iron affects dopamine levels.
Which is kind of cool because dopamine is intimately related with Parkinson's disease.
Yes.
Pathophysiology, and actually L-DOPA is one of the treatments for Parkinson's. And dopamine class medications are also used to treat restless leg syndrome.
Right. So for a while, I was on a medication called pramipexole because I was like, this is brutal. You got to get some. You got to get some for those legs because it's crazy. Yeah. And so I tried this for a while, and it actually worked pretty well. I was not to the best at remembering when to take it. So you have to take it like an hour and a half before bed, and by the time you're going to bed, you're like, oh, I forgot to take a pill or whatever.
Doctors are the worst with compliance.
The worst seeing a doctor and the worst doing what I'm told. So it did work actually pretty well if I remember to take it in a timely fashion. So essentially the Parkinsonian class drugs are worth considering. One thing that has been shown though, unfortunately, is that the longer that you take it, and as your dose increases to get an effect, sometimes you can suffer from something called augmentation, where paradoxically, as the dose goes up, your symptoms go up. And the symptoms will improve as you reduce your dose again, but then you're kind of back stuck because now your symptoms have gone back down, but now you're not taking the medications, then go back up. It's a little tricky. So
how's that for one of the medical treatments?
I know.
Here's a medical treatment for you. It should get rid of your problem. There's a chance it makes it worse.
Yeah.
All right.
And then
gabapentin class.
Yeah. So the nerve we talked about, that's kind of a nerve problem.
Then there's narcotics. Narcotics is a class of drugs that are sometimes used.
Which I found shocking. And I think it's probably more historical than my guess is currently, just because we're so nervous about narcotics and our bodies do get used to narcotics, so your dose would likely have to go up over time. So
And there is an opioid crisis in the world right now, so we use those as sparingly as possible.
Yeah, and that's tramadol, oxycodone, even methadone was mentioned as one of the treatments. So the other thing that I would say is a big part of the treatment is, and we've talked about this before, it's good sleep hygiene. So some people talk about exercise. Again, there seems to be a U-shaped curve when it comes to exercise. If you're really inactive, that can make it worse. Sometimes people that do really strenuous exercise right before bed, that can make it worse. So somewhere in between. So not being inactive, but maybe not being too active. Yeah. Leave a comment if you find exercise helps. Some people talk about a cold shower or a warm bath. Yeah. Who knows?
Find your groove.
Yeah. The one thing that we didn't mention about the supplements that very commonly is talked about, but there's not a lot of good scientific evidence necessarily for, is magnesium. That seems to play a role in so many functions. We've talked about this before, so whether that's oral magnesium supplementation, whether it's using Epsom salts in a bath, or even a topical rub, magnesium potentially can play a role.
Or your diet. If you can get the magnesium in your diet, that's also
We think anything that you can get in your diet's better.
Better than a supplement whenever you can. All right, I think we should tell people how.
Yeah, so I had this for forever, like decades, as long as I can remember, and then I started to realize, hey, I'm not having this as much, and I went like plant-based with my wife about 5.5 years ago or something like that, and it seemed to have gone away. I'm certainly not saying this is the cure. I'm not like an anti-meat person. Hey, do what I do. It worked for me. I probably won't work for everybody, but
do you think then for you it was some primal drive to go hunting in the middle of the night when you were a carnivore?
Oh, maybe. Yeah, maybe. And then I was like, I don't need to hunt. No. Do you think that's what it was?
No.
I don't think it was either.
I don't Elvis Presley had it? The way he gyrated.
Yeah, maybe. I'm not.
Michael Jackson?
Maybe.
Maybe the moonwalk came from restless leg syndrome.
Possibly.
Well, we have Willis and Ekbom to thank for
Yes.
this, and it's kind of not a ton known about it.
Nope.
Underdiagnosed, probably.
Yeah.
Quite common in the community, more
Yeah.
common in pregnant women.
Potentially very debilitating.
Yes.
So you're not alone, and go talk to your doctor. There are some potential helps.
And hopefully, just getting it out there with this video gets you to talk about it. If you think you might have it, go see a healthcare provider, see if you can get that diagnosis, and then start some treatment for it.
Now you know. Like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.